Raise your hand if you've ever been in braces. I remember how fun it was picking out what color bands I was going to choose for the month. You know you were that kid once too. Did you know having crooked teeth increases your risk for tooth decay and gum disease? Braces not only properly align teeth to improve the look of your smile and your self-esteem, but more importantly, they will improve your oral health. But being in braces also poses some challenges. If you've ever worn braces, you know firsthand how difficult it is to keep them clean. Now, the brackets and wires work really hard to guide our teeth into proper alignment. Often, it can take years to complete. All that extra metal work in your mouth make it more difficult to clean, creating more opportunity for plaque and food bits to get left behind. If you aren't careful with your oral hygiene at home, tooth decay and gum disease can happen. Now, as a dental hygienist, one of my roles is to show my patients how to maintain the best home care while in braces to have the most successful treatment outcome. And I'm here to share some of my tips and tools to help keep your smile healthy and happy while in ortho. And yes, there are many options for clear, removable aligners, which makes brushing and flossing easier to do. But for many cases, traditional ortho is the better option and sometimes the only option. Many of my patients in ortho are adolescent age and sometimes lack the care or even the interest in keeping their teeth clean. And it's not just enough for parents to remind their kids to brush, but then they don't take the time to inspect their kids' teeth at home. The sad and often truth is not having good oral hygiene while you're in braces can lead to damage to your teeth, requiring hundreds, sometimes thousands of dollars in restorative treatment later. We want your teeth to look like this, not this while in braces. And when you're done with orthodontic treatment, we want them to look like this, not this. Curious to know what these white spots are? These white spots are the first stage of a cavity. They form by not brushing well, which leads to plaque buildup. Cavity-causing bacteria and plaque feed on sugar and carbohydrates, which causes acids on the tooth surface. If not brushed often enough, these acids get left and the prolonged exposure can cause a hole, aka cavity. Now, I've seen patients return for their first dental cleaning after their braces are removed and have these white square-shaped spots on their front teeth. Sometimes they can even become brown and brittle, leading them to chip easily. This can be so disappointing when this happens. No matter how straight your teeth are, once a brown stain forms or the tooth starts to chip, it becomes irreversible and restorative treatment is needed. Now, these white spots can be prevented and even reversed by, you guessed it, flossing and brushing. But it's not just enough to brush once a day and floss once a week. Trust me, we can tell how often you do it. Brushing at least twice a day, or in some cases after every meal, and flossing at least once a day consistently will keep plaque and food bits from collecting. Now, how you brush makes all the difference too. Since the brackets and wires tend to trap sticky plaque and food bits, it's really important to not only focus the bristles toward the gum line, but also angle them around the brackets. Do make sure your teeth are especially spotless before bedtime. If you skip brushing at night, you're allowing these acid-causing bacteria to attack your teeth and gums the entire night you're sleeping. Your dentist may prescribe a prescription toothpaste and rinses with fluoride or nanohydroxyapatite to help remineralize your teeth in the efforts to reverse these white spots. Now that I've talked about ortho increasing your risk for tooth decay, now let's switch places to how it causes gum infection. Bleeding gums is never normal, but it's really commonly seen in ortho patients. Sometimes I've seen it where swelling extends all the way to the brackets and wires. Flossing becomes more challenging due to the wires, and this allows more chance for plaque buildup beneath the gum tissue to occur, leading to gum inflammation. When left untreated, this can lead to bone loss. Now, your dentist may prescribe an antiseptic rinse to help and be used in support your efforts at home to maintain gum health and to control future gum problems. Here are some of my favorite hygiene aids designed for braces.
All right, brushing and braces. So as we talked about, the food bits and plaque get stuck all around the brackets and it just becomes a problem zone. So you really want to focus the brushing not just around the gum line, but also around those brackets and wires. The Burst-Sonic toothbrush works really well at getting in between with those tapered bristles. And of course, it's 33,000 sonic vibrations. It's awesome. And don't forget to show some love on the inner areas of your teeth. Plaque love to collect there too. This tufted brush works really well. This just helps isolate those areas so you can get in there a little extra there. Maybe put a little toothpaste around that area and just brush all around and just spit out so that toothpaste gets left behind there, and it just helps remineralize those areas. Look how well that gets in there. These proxy brushes are awesome. They come in different sizes because, of course, ortho patients are more cavity prone, especially in between. Look how well it gets in between those teeth. And for you traditional flossing fans, these are threaders. These are used with just traditional string floss. You're going to run the floss through that little loop there, and then this end is the threader. Voila. And yes, this can be tasking because you're literally running the floss in between every single tooth. But again, this is such an important investment. Keeping your teeth healthy is just crucial while you're in braces. And if flossing is not an option or it's just more difficult for you, I would really recommend the water flossers. They work really well because the steady stream of water is what blasts away the plaque and sugars off your teeth. So you always start in the back and you just follow the shape of the gum line and let that steady stream of water really irrigate everything off. This is cinnamon on the Typodont, just to help demonstrate the power behind the water flossers. Look at that. Clean teeth.
Now, as much as good oral hygiene impacts your chances of a healthy smile after braces, choosing healthy food and drink options are just as important. Now, keeping a low sugar diet works best. Try to limit sodas, sweet tea, Kool-Aid, even fruit juices have some hidden sugars. Sweets should also be limited, especially sticky ones. Another food that you may not think increases likelihood of cavities are crackers. These are notorious for sticking around brackets. Because they're carbohydrates, a form of sugar, bacteria will also feed off these sugars, creating harmful acids as well. Sour foods like pickles and lemons should also be limited because of its acidic nature. We know acid exposure softens enamel, which makes it easier for cavities to form. Now, I'm not saying you can never have these sweet treats and sour foods. That would just be cruel. But really important to understand that the frequency of sugar and acid exposure can make a difference in increasing your risk of tooth decay. For example, instead of drinking a sugary beverage every day, try cutting back to maybe 1 to 2 times a week. Also consider drinking them with a meal. Foods will help buffer the acids. And don't sip sugary drinks over a long period of time. Do consider tossing the rest once you're done your meal. Do sip water throughout the day, and it's very helpful to rinse out with water after any meals, snacks, or sugary drinks are consumed. It's really important to visit your dental hygienist at least every 6 months for cleanings. Depending on how well the ortho patient is maintaining their home care, we may recommend cleanings every 3 months if it looks like someone continues to have poor oral hygiene. And the orthodontist should also assess how their patients are maintaining their home care during their monthly ortho checks and wire changes. Some cases, they may even remove the braces if they find their patient has tooth decay or poor gum health, even if treatment isn't complete. Remember, braces is an investment. How you keep up with your home care will impact how healthy your smile is when your ortho treatment is complete. And good luck to anybody that is about to start ortho or currently in orthodontic treatment. I do hope my video was helpful. Hit the like button if you did. And subscribe to Burst TV if you haven't already so you can catch our weekly videos. Thank you for watching Burst TV. Take care.